Hello viewers, today we will practice OET speaking with Dr. Pritha Ghosh. She has successfully passed MRCS ENT and has hopes of moving to the United Kingdom. In order to work as a doctor in the United Kingdom, you first require to be registered with the General Medical Council, and to get registration with the General Medical Council, you have to prove that you are proficient in the use of the English language. One of the best tests for English language is occupational English test, which consists of 4 subtests: listening, reading, writing, and speaking. We will practice speaking with Dr. Pritha Ghosh. A typical speaking sample test, a speaking test lasts for 20 minutes. It consists of 2 speaking tasks. There is a role player card with the interlocutor and there is a candidate card with the candidate. So I will be playing the role of the interlocutor. In a typical speaking subtest, which can be organized virtually by Zoom. If you're taking OET on computer, if you're taking OET on paper, it will be held in person. So what happens is, for the first 3 minutes or so, there is an informal interaction with the interlocutor where you have to confirm your identity, you have to show the passport, you have to show that in the room you are not having any material which can give you unfair advantage. All of that is checked and you familiarize yourself with the accent of the interlocutor. Then you move to the speaking tasks. The speaking task, as you can see on the screen, there is a setting. This setting here is local medical clinic. There is a scenario. In this scenario, there is a 45-year-old patient who is recovering from a mild heart attack, which the patient had 2 weeks ago. He was discharged from hospital 4 days ago. You are seeing the doctor because you are unsure how much physical activity is appropriate. You are concerned it might bring on another heart attack. So this is the scenario. And then there are specific questions that you want to ask, and there is specific guidance that the doctor has to provide. So the corresponding tasks are available with the candidate also. So what the person is supposed to ask and the appropriate response, all of that is provided in a bullet-wise fashion, and you have to speak accordingly. The speaking criteria or speaking subtest is marked on 4 linguistic criteria and 5 clinical communication criteria by expert assessors, not by the interlocutor who you are speaking to. Okay. The recording or the audio recording of this speaking session will be sent to people who will assess this speaking subtest, and they will mark it on 4 linguistic criteria and 5 clinical communication criteria. The linguistic criteria are intelligibility, fluency, grammar, all of that is there. And that I have described in a different video. So Dr. Pritha Ghosh, are you ready? Then we'll start the time.
Hi.
Okay,
Yes, please.
let's start the time.
Hello, good evening. I'm Dr. Pritha Ghosh. Could you please confirm your name for me?
So my name is Matthew Smith.
Hi, Matthew. Could you please also confirm your date of birth for me?
I am 45 years old.
All right. Matthew, I understand that you have had a heart attack recently and you have undergone a procedure and you have been discharged recently from the hospital. Could you just tell me more about whatever problems you're having right now in your own words?
Yes, so I felt much weaker and I'm very tired since the heart attack. I'm really worried that even walking or gardening or swimming might bring on another heart attack.
Well, I do understand your concern, but let me reassure you that this is very common. The fatigue that you're feeling, this tiredness that you're having is very common, and it is expected to be fully recovered within a period of 4 to 6 weeks. So please do not worry about that. And any kind of activity or any kind of activity or any kind of lifestyle changes that are required has to be very gradual. Any kind of sudden changes are not to be taken. Am I able to explain, sir?
Yes.
Well, I would also like to emphasize on any kind of exercise. So a very heavy exercise is not allowed at this moment. So you will have to do a kind of moderate physical activity is allowed. And that has to be obviously done under supervision. So I would also advise you to join our cardiac rehabilitation program, where you can exercise and see how much you can tolerate under supervision. Is that okay?
So how much activity is advisable?
Moderate activity.
Okay. But I'm an office worker and I
And
sit at a desk all day. So I don't get much exercise done at work.
of giving more heart attacks, which you have already suffered. So, therefore, I would like to emphasize on exercising so that we can prevent any further attacks. Is that clear?
Yes. But I'm an office worker. I sit at a desk all day. I don't get much exercise at work.
I understand. That's why we have been asking you to join our cardiac rehabilitation program where we will help you exercise and see how much exercise you can tolerate.
Okay.
And I would also like to tell you that before you join back to work, please do not rush it. It has to be very gradual and you have to be physically and mentally ready to go back to work.
Okay.
Also, if required, you can take support from your employer, and if required, we can talk to your employer regarding the leave that you're taking for your health.
Okay. But
Do
I'm
you
really
have any
worried.
other
Is there
particular
anything I
concerns?
can do to prevent the risk of further attacks?
Yes, I will tell you more about it. Well, I would like to emphasize on diet, like you should include vegetables and green leafy food, and lifestyle, like I said, more exercise, physical activity, the kind of sleep that you get, the stress has to be reduced. All right.
Okay.
So I would like to reassure you again that this problem that you're having, this concern about tiredness, this is very normal. Please do not worry about it, and it will gradually get better in a period of 4 to 6 weeks. Okay.
Okay. So thank
So
you for
I'll
that.
just, yes.
I'll do more
So I
exercise
will,
and I'll look into the rehabilitation program.
all right. So I will just summarize whatever I have told you so far. So I have told you about the gradual return to work with some kind of lifestyle changes and gradual exercise, which is very important, and joining the cardiac rehabilitation program. All right.
Yes.
Thank you so much for your time.
Do you think I need any blood test done?
Well, yes, we can do a blood test, but not at this moment. Once you are to review back at our clinic, we'll do those then.
Hmm. Okay. Thank you. It was very helpful.
Thank you so much.
Okay. So that is the thing. Now this is the time. Finally, you finished well in advance, almost 30 seconds before,
How
which is
advanced is
okay.
it?
I
Oh,
think if I have to nitpick, then maybe you can speak a little bit slowly and keep
yes, okay.
the information can be a little more succinct. It can be shorter with what you're saying. Otherwise, it's fine. I don't think there was any problem. But
Mhm.
let's go and practice. So you'll have two role play cards in a one session. Sample test one was this. This is sample test one. Do they have only one? Oh, they have only one. Okay, fine. Let's do another one. Sample test two. Open sample test two. Do you have it with you?
Yes, I've opened the sample test now. Yes, I have it with me.
Okay. So what we did not do is when you are reading, you will get time to read the card. Okay. After you have finished the informal conversation with the interlocutor, you also get time to read the card. When you are reading the card, you can ask the interlocutor questions like, so this is a local clinic. Do I already know the name of the patient? Okay. Is the patient known to me? You
Okay.
can ask these questions. And
All
in
right.
my OET, the interlocutor had said that you can play it as you like it. Okay. So interlocutor said you can
Okay.
approach it like you know the patient or you can patient.
Okay.
Right. So sometimes that
Okay.
happens. Your PC needs to be restarted to finish setting up devices. Oh God. Okay, fine. And you can also ask the patient, You can also ask the interlocutor what is the name of the person you're talking to and how do you address the person.
All right. Mhm.
So this saves time. Okay. So you can read it and you can ask me questions.
All right. So here the bacha is not present with the parent.
So this is a
So
local clinic.
are you the mother or the father?
You read. Huh? So I am the father.
So it's
of a
like
fi- I'm the father of a
you're the
5-year-old.
father. It says a local clinic, and you see a parent of a 5-year-old boy
Yes.
who
So
was
I'm the father
diagnosed
of a
with
5-year-old boy.
asthma.
Yes.
Yeah, who has been diagnosed with asthma a couple of days ago after attending the emergency department with a severe bout of cough, breathing difficulty, and wheezing. This is a follow-up appointment. The child is not present for the discussion.
Hmm.
So I'm supposed to confirm the reason for this appointment, like follow up following asthma diagnosis, find out how child has been since his hospital visit, like the severity or the frequency, and how is the treatment being effective. Find out further relevant details, any family history like asthma, eczema, hair fever,
Hmm.
if there's anyone else in the family who has a similar episode. Explore possible triggers of the child's asthma like cigarette smoke, dust mites, pollens, exercise, cold air, etc. And give them information about child asthma disease like chronic lung disease, tightening or narrowing of the airway, swelling, inflammation, production of extra mucus, and all that. And risk factors like family history of hay fever. And then find out the concerns if the parent has any, and reassure the parent about the child's asthma that it is manageable, regular monitoring is required, and support is available. And describe the asthma management like identifying and controlling the triggers, assessing severity of symptoms, knowing how to respond in urgent situation, and informing child's school, etc. And outline the next steps like examination of the child, creation of asthma action plan, discussion of treatment, organization, support, follow-up appointments, etc. Establish parents' willingness to bring child into a room for examination.
Okay. So you are clear about all this. Is there any doubt?
Yeah, no,
No doubt. So let's start. Let's start
no.
the timer. I'm the father. Start.
All right. Hello, good evening. I'm Dr. Pritha. Could I please confirm your name?
My name is Matthew Smith.
And I believe that your son was with us a few days ago. Could you please confirm his name too?
Yes, his name is Tom Smith.
All right. So I understand that Tom had an attack of breathing problem, and this is a follow-up appointment. So I was just wondering what are the problems that you're facing right now? Could you just tell me in your own words?
Yes, so my son has asthma. It's not that bad. He had one attack since he was
Mm-hmm.
diagnosed at the emergency department when it was quite
Mm-hmm.
severe. But ever since it's been
All
okay.
right.
He has used inhaler and spacer that were given to him at the hospital, and I think it has helped his symptoms.
So is he doing better after the hospital visit?
Yes, he's been doing okay.
And you feel the treatment is effective?
Yes, I think so.
All right. So is it okay if I ask you a few history about your family?
Yeah, sure.
All right. So does anyone in your family have a history of asthma
No,
and any kind of skin disease like eczema,
no.
hay fever?
Yes, I get mild hay fever in the summer.
I understand. Well, do you have any idea as to what might have triggered Tom's asthma attack recently?
I really
Any
have
kind
no
of
clue
cigarette
because
smoking in the house?
there is no one
Mm-hmm.
who smokes in our house, and we try to keep our house really
I
clean.
understand.
I think he
All
has these
right. I
attacks after he
understand.
has been
Mhm.
running about outside.
So most likely in Tom's case, it is that it is because of the exercise, but we might have to do a few more examination to know if what are the exact causes. Is there anything when you see when there is exposure to cold air, maybe?
I think so. I think he has these attacks when he's outside.
Okay, I understand. Well, how much do you know about child asthma? Childhood asthma,
We
I'm
were
sorry.
told a bit about it, but we found it very overwhelming. So I'm really not sure how we can help him manage his condition because sounds very overwhelming to us.
I understand your concern. Do not worry. I will tell you more about it. Well, childhood asthma, basically, asthma is a chronic lung condition, all right, where there are airways in our lung, which happens to narrow and cause more mucus production due to certain triggering factors like cigarette smoking, maybe, or dust, or pollen, or exercise. These can lead to constriction of these airways, leading to these breathless spells that Tom has, and excessive cough with mucus production. Is that clear?
Yes.
So, do you have any other concerns at the moment, or is there anything else that you would like to know?
We feel a bit reassured, but if you could tell us more about
Mhm.
how we can manage the condition.
Yes, I understand. Well, please do not worry. This childhood's asthma, as in Tom's case, is not very severe. It is mild, so it is very much manageable with the medications that we have provided with him. But he needs regular follow up with us, all right? And there are supports available. But I would also like to tell you that please try to know as to what might be causing this the triggering factor, or the causes as to which might be leading to this breathlessness smells.
Okay.
And you have to always assess for the severity of the problems. If it is very severe, where you feel that the child is having a lot of problem breathing, then you might have to immediately inform the school also about his condition, and you might have to rush him to the hospital. So you have to be aware of all this.
Okay.
All right, so I will tell you next what are to be done. So is it okay if you can bring Tom in for the next appointment so that we can examine him well?
Yes, I'll do that.
All right, so we'll actually examine him, and then we'll create out an action plan, what needs to be done if he has an acute attack. And we'll also be discussing the treatment in further details. And then we'll tell you more about the follow-up appointments. Is that all right?
Yes, that's fine.
All right. Is there anything else that you
That's
would
the
like to ask?
time.
All right, so
So
I'll just summarize
here,
everything for you.
here you are not able to summarize. So that
Yes,
is a
I know.
negative point. Otherwise, everything else was perfect. But you have to be a little
All
bit
right.
more aware of the time.
All right. Yeah, I was not seeing the time as because of the last exam that I gave, where I was not allowed to see the time.
Yes, so in this exam, I think you'll be able to see the time. So, okay.
All right.
That was good, I think.
All right.
You just have to, so all the
All
preparation
right.
resources are available on the OET website.
Mm-hmm.
And there are some available
Mm-hmm.
on the OET official YouTube channel as well. There are some premium
Right.
preparation providers whose names are also mentioned in the on the OET website.
Yes, I've
So
seen that.
there's no need to worry, I think. It'll be fine.
Right. All right.